evening, everyone, and welcome to our second annual My Sister's Keeper Week. MSK Week is focused on young Black women making their health a priority. My name is Janae Epps, and I am the director of My Sister's Keeper and Positive Period for the Black Women's Health Imperative. Our panel event tonight is titled Grab Your Girls and Go, Navigating the Healthcare System and Community Care is Needed Too. I have three amazing women joining me today as we discuss issues that impact Black women, what's happening in the healthcare system, and why community care is just as important as self-care. Let's start with an introduction to our panel. First up, we have Lauren Cornigan, the founder and executive director of Endo Black Incorporated. Lauren is a native of Oxon Hill, Maryland, and graduated from Morgan State University in Baltimore, Maryland. Diagnosed with endometriosis on March 18, 2011, at the age of 20, Lauren experienced the pain, struggles, exhaustion, and confusion accompanying her disorder. Due to a lack of representation and acknowledgement of African American women affected by this disorder, she felt alone. So in October of 2015, Lauren established Endo Black Incorporated, a platform designed to connect African American women and women of color affected by endometriosis. Her main goal is to raise awareness about African American women and women of color being affected by endometriosis because no one should feel how endometriosis affects women of color differently to make proper diagnosis. Welcome, Lauren.
Hello. Thank you. I was stuck on mute.
It's
Thank
in
you so
today,
much
we
for
know.
having me here today.
Yes, of course. All right. Next up, we have Dr. Magdala Sherry, the Health Equity and Clinical Operations Lead for Health in Her Hue. Dr. Sherry is a board certified internal medicine physician, a highly sought after thought leader with over 10 years of speaking experience, and a former 2020-2021 Commonwealth Fund Fellow in Minority Health Policy at Harvard University, earning a Master of Public Health. Most recently, she was named a National Minority Quality Forum 40 Under 40 Leader and Minority Health Awardee for 2021. Prior to the fellowship, Dr. Sherry served as an assistant professor of medicine at Rowan University School of Osteopathic Medicine and was named one of South Jersey's magazine's top docs in 2018 and 2019. She is passionate about expanding the conversation on primary care, mental health, and wellness in minority communities outside of the exam room. Dr. Sherry is also the founder and chief operating officer of Not Just a Black Body Incorporated. Through the hashtag Not Just a Black Body campaign, she has been lending her voice and platform as a physician and as someone who has directly been impacted by COVID-19 to boldly address racism in the healthcare system. Dr. Sherry received her medical degree from Rowan University School of Osteopathic Medicine, formerly UMDNJ School of Osteopathic Medicine, in 2014 and completed her internal medicine residency at the University of Connecticut in 2017 with distinction in primary care. Welcome, Dr. Sherry.
Hi there. Thank you so much for having me. I'm looking forward to this conversation.
Yes, thank you for joining us. Next, we have Adey Ashinubi, who is a documentary filmmaker, photographer, and a fourth-year medical student in Providence, Rhode Island. Her work focuses on sharing the stories of minority populations that often go untold. At the age of 16, Adey traveled to Mekelle, Ethiopia to co-produce her first documentary. Since then, Adey has produced films educating the public about various health topics ranging from the COVID-19 vaccine to postpartum pelvic floor conditions. Starting from her first year of medical school, she independently filmed and produced Black Motherhood Through the Lens, a documentary about 4 Black women's experiences in navigating infertility, childbirth, and postpartum mood disorders. Black Motherhood Through the Lens has been accepted to 7 film festivals, including the American Public Health Association Film Festival, and it received the 2021 Best Short Collective Award in the Rhode Island Black Film Festival. Her work on the documentary was also recently recognized in Forbes magazine, amongst other places. In addition to filmmaking, Adey has published articles for the Washington Post and Glamour magazine on topics related to health equity. She was recently named a National Minority Quality Forum 2022 40 and under lead 40 under 40, leader in health, and is a member of the Alpha Omega Alpha and Gold Humanism Honor Societies. In the future, Adey hopes to pursue a career in health journalism, using her passion for photography and film to elevate the voices of communities of color. She will be starting emergency medicine residency at the University of Pennsylvania this summer. Welcome, Adey.
Thank you for that lovely introduction. Really happy to be here.
Yes, thank you, thank you. So as you all can see, my girls are here and we are ready to go all in on this discussion today. So please feel free to ask questions and we will get to them during our Q&A roundtable. So I'd like to bring back up Lauren. Hey, Lauren.
Hey.
So, Lauren, as someone with endometriosis, what has your experience been navigating the healthcare system?
For me personally, it has been okay. Living in Prince George's County, I have access to a lot of resources and a lot of doctors of color. So for me, it has been okay, but it's still a little difficult navigating because some of the history and some of the education has been built off of, unfortunately, um, unfortunate circumstances. With J. Marion Sims, him being the father of modern day gynecology, and that just shifting into the narrative now. So it is a little difficult sometimes. Um, I've had situations where doctors have been great. It has been a great experience for me where they've been very supportive. I've had the diagnosis with endometriosis, which it didn't take long to recognize in my case, but for a lot of other women, it is much longer to figure out what is going on to get a proper diagnosis because of it could be their environment, it could be the bias in the community at times, or it could just be a lack of resources. But for me, I'm actually really blessed to have an opportunity to be around some good healthcare systems.
Yes, thank you for sharing that, Lauren. And I know we hear so many horrible stories, right, and some negative experiences while navigating. So I am happy to hear that your experience has been good for you, and that you've been able to navigate that with folks that are in support of you and your journey. So, what are some misconceptions about navigating the healthcare system with endometriosis? So, and that could be for other Black women as well, regarding diagnosis, treatment, follow up, etc.
Some misconceptions could just be not having that close relationship with their doctors. A lot of times we don't recognize that um, doctors are people too. And the truth of the matter is, I think if you are going, especially to your OBGYN, they see the most vulnerable parts of you. So it is great to have a good relationship with your doctor. And there is a misconception that sometimes people with degrees, medical degrees, they know a lot of information. However, they do not know your lived experience. So sometimes it is okay to, share your opinion, talk to your doctor about it. And if you don't feel comfortable, it would be pretty difficult to do that. So just having that relationship, feeling comfortable enough to talk to your doctor, to ask questions, to let them know that you are confused about different things. Another thing that I think can be a misconception, specifically with endometriosis, when we're talking to doctors, is that the notion is birth control, hysterectomies, pregnancies cure endometriosis, and they don't. Now, I will say in certain people's cases, it has been helpful, but you never want to say, oh, you should get pregnant to cure anything. That is a lifelong commitment. I think people need to take that into consideration. Also, hysterectomies. Hysterectomies are known to help people to relieve pain. However, it's not the case for everybody. So, as long as we're putting all the facts and all of the information out on the table for people to understand, to do their research on, I think that those should be especially hysterectomy and birth control should be like the last option before you try other different things. Another misconception is that you cannot get pregnant with endometriosis, which can be kind of confusing if your doctor is telling you to get pregnant. But the truth of the matter is, there are a lot of women right now, a lot of people that have endometriosis that have children. I think it's okay to ask your doctor again, to have that relationship with them, to figure out a plan. If you are seeking to have a child, if you're seeking to look into an opportunity for you to grow a family, you should be talking to your doctor about that. But don't automatically cut yourself short because you're diagnosed with endometriosis. And I think those are some misconceptions that a lot of people, unfortunately, deal with when endometriosis is presented. And sometimes we just don't have all the facts. And I think it's really important for all of us to do our research.
Yes, thank you for that, Lauren. I think it's so important how you pretty much mapped out some of the other things that you can do before some of these extreme measures like hysterectomies and things like that, because that's what happens, right, in the Black community for Black women. You hear about this diagnosis and you immediately think, oh, something has to be removed, something's wrong with me, something has to be taken away, when there's so many options. But to your point, you have to talk and be aware of those resources, and get connected so that way you can navigate the system appropriately and get rid of some of those misconceptions. So thank you for that piece. So what are some of the other issues that Endo Black is addressing as it relates to endometriosis?
Yes, thank you for asking that. I think this is one of my favorite questions because it allows us to share, all of the different things that we're trying to do in the community. Endometriosis is important, awareness for it and advocacy is important, but also just supporting other organizations and other groups to make sure that they're feeling comfortable, to make sure that we're getting awareness out about that. Also, we are in the process of doing our period care initiative, which is an initiative where we're focusing on making sure that we're connecting domestic violence survivors as well as young African American women or girls in the community with non toxic chemical sanitary napkins, period care items, and things of that nature. As we know, things are expensive. Pads are expensive, but when you get into the non-toxic realm, it's just it increases a lot, and people don't have access to that. And a lot of times we're always suggesting like, oh well, if you have pain and endometriosis, the first thing you need to do is eat healthier. What if I don't have access to healthier food? How can I eat healthier? We'll use non-toxic chemicals. If I don't have the funds to purchase it, how can I do that? So we're just trying to make sure that we meet people halfway and provide these items to them and just to also share some education about it because we don't know what's in a lot of the other products. And if we don't know, that could be harmful to us. So it's important to make sure that we're getting that information out. It's important to make sure that we're providing those resources. We also have conversations about CBD, THC in the African American community. We have a target that's specific to health equity and racial injustice, where we talk about these things at least once and twice a year to make sure that we're breaking down barriers and learning about different things. Unfortunately, there's a conversation that has to be had about some of the older ways that we've been living, especially in the African American community. We have to be more vocal about certain things. That's why we've also taken a liking to talking about mental health. We also make sure that we have a mocktails and cocktails target where we're focusing on doing random topics about mental health, skincare, endo diet, things of that nature. All of that is just to educate and really just make sure that we are advancing the conversations in the African American community specifically, and also for those of color.
Yes, thank you for that, Lauren. I love how you all are just connecting many of those social factors that go into it, right? So endometriosis is just the diagnoses, right? But there are other things that folks are dealing with outside of dealing with their condition. So I love how you focus on domestic violence survivors and the connection with that, obviously focusing on periods, right? So we do work with periods as well. And so knowing that a lot of the stigma that's associated with that, and knowing that sometimes that your period can be an indicator, and period pain can be an indicator for endometriosis. So I love how you guys are connecting that. But then also having conversations, right? Bringing in some of those other things like CBD and things like that that folks may not connect to the conversation. And so on that same line, what are some of the symptoms or just the experiences that folks with endometriosis have? Like, what does the day look like when you're experiencing endometriosis? I would say at its fullest scale, right? Because I think there may be some phases in how you deal with it.
My On the fullest scale, I am in my bed in the dark, my eyes closed because I have a migraine. Um, and it has happened. Thankfully, it hasn't happened very often for me. I think it happens closer to my cycle, depending on, what I ate or something I may have done that day, that has triggered it. And it's been times where I haven't been able to get up. I've gotten up to go to the restroom and then got back in the bed because I was in so much pain, or my head hurt so bad because I couldn't open my eyes to light. So sometimes it's terrible. Sometimes you don't feel like getting out of bed, you don't want to do anything, you don't want to be bothered. um but other times you live regular life and you don't even notice it sometimes, but you are mindful of the food that you eat. You are mindful of the environment that you're in. If you're at work and you're a little bit more stressed, you're probably like, oh, well, let me calm down. Stress can trigger my flare ups. Let me be mindful of that. Or if you're out at a restaurant, you need to really pay attention to that menu because there's food on your menu that could possibly trigger you. So it it encompasses a lot. It can encompass pain, but it also can encompass brain fog. That can kind of mess up your cognitive thinking a little bit. And that happens to me probably a little bit closer to my cycle. That's when most of my symptoms are heightened, is when I'm closer to my cycle. You can also have back pain. You can have cramps. Cramps in your abdomen and in your back. The sharp pain sometimes can really cause, some severe trauma to your body. And you just have to be mindful and know that you can get through it. Sometimes it's 10 seconds of pain. Other times it's a full on hour of pain. So I try to track it. It's not easy. I don't always get a chance to track it, but I try to pay attention to some of the pains that I feel. If I'm ever sick, if I'm throwing up, if I'm nauseous, I just try to get a little mindful of it. And like I said, it most of these symptoms are heightened right before my cycle. So I have this regimen that I try to do right before my cycle so I can get my mind wrapped around it. If I'm drinking more ginger juice this time, if I'm drinking more water this week, if I'm staying away from red meat, if I'm staying away from dairy. So I try to do my part, but unfortunately I do know that flare-ups are going to happen. I just have to be mindful of what I'm doing on my end to at least lessen the pain or just manage it effectively.
Yeah, yeah. And it's interesting because some of the symptoms that you shared about the flare-ups mirror other conditions, right? And so as you're experiencing them, you may think it's one thing, but it's another, right? So that, also triggers like, being aware of what's happening to your body and going to get things checked out, right? And so getting into that system, right, to figure out what exactly is going on. So thank you, Lauren, for your insights today, and I will loop you back in for the roundtable discussion. Thank you. Dr. Sherry is up next. Hey. So,
Hey.
Dr. Sherry, I can only imagine what your day-to-day looks like, especially with COVID, as a physician and all of the great work that you are doing for the Black community and communities of color. So how are you expanding the conversation on primary care, mental health, and wellness in minority communities outside of the exam room?
Yeah, great question. So I guess I have to take a step back. Obviously, when, I went to med school and I'm thinking about becoming a physician, I'm excited about just, being able to see patients in the office and care for them and just understanding the impact of representation, right? Like what it looks like to see a woman like me with this big hair as you open the door and step into the office, right? And I did see that. Like I saw patients the minute they saw me and they weren't expecting a Black woman and they were Black, and they would just like have a sigh of relief and be like, whew, and just get really excited. And as much as that like was fulfilling, the other parts is that's 15 to 20 minutes, right? So a lot of times you're not getting everything you need to know about that person, about where they come from. So for me, extending the conversation beyond the exam room has been first community, right? Before I'm a physician, I'm a Black woman, right? I'm part of a community. I'm part of, I'm someone's daughter, I'm someone's friend, So for me, it's been like, how do I find ways to engage in community on multiple levels? Because sometimes, even as Black women are presenting with symptoms, it may not just be about them. It may be about a loved one, like they're a caregiver, or they're really stressed about what's going on in school for their children. So the more I'm engaged in the community to know what's happening, those social factors that Lauren so eloquently put together, the more I understand that, the more I can have an expansive conversation about, you know what, your blood pressure isn't just your blood pressure. You are going through something else. And as a result, you're not having access to healthy food. That's why your blood pressure is going up. So the first part of that has been community. And then the second part about that has been asking questions. So when the patient actually does come to me, you had symptoms, but you've had them for 6 months. Why are you showing up now? What is your fear? What are you afraid of? What have you experienced with the healthcare system prior to me that is going to be really helpful in me thinking about how I care for you? So creating this non-judgmental atmosphere so I can ask those questions and listen, right? And listening is not just what they're saying, but even their body language. And then my last aspect is going to be being a part of organizations like Health NRU. So I currently serve as the Health Equity and Clinical Operations Lead for Health NRU, which is a digital platform that aims to connect Black women to culturally sensitive providers, evidence-based content, and community, but essentially is building for the Black woman, thinking about them, how they need to see relatability, how things need to look so they can feel seen and heard in a lot of their healthcare experiences. So for me, not only seeing patients, but also saying, how do I work with other platforms that are thinking outside the box, that are using technology to connect other women, is a great way for me to say, what can I do outside of the exam room?
Yes, thank you, Dr. Sherry, for that. That is so important, right? Because of course we need our physicians, right? But we also want to see them in community with us, right? We want to see them in the places where we are navigating and see their support there, because it's like you said, it's so much more that goes into just them showing up and meeting with you for 15 minutes. So much more. And we know that. And
Absolutely.
so I appreciate you for taking that time and being connected outside of the exam room, because we need that. Black women need that especially. So thank you for that. So my next question to you is, what should young Black women consider when they're navigating the healthcare system, and how can they prepare for discussions with healthcare providers about issues or conditions that disproportionately impact them?
Right. Great question. And I think Lauren started to allude to this as some in some of her responses to you too. So my advice would first be, make the time. So one thing I always tell patients when they come to see me, they're either trying to squeeze me in before they're going to work or after work, and you can almost feel that rushed feeling that they have when they're coming into the office, or because they're so used to working with doctors who are often rushed or going to the next patient, they present that way. I tell people, make time. So if there's a certain day where your schedule's lighter, so you can actually sit in the office and wait for the doctor, so you can have all your questions addressed, do that. Come in and, use your phone, use a notes page on your phone. And if there were certain symptoms that you've been experiencing, keep a tally, have that down. And when you walk in, set the tone. hey, doc, I know I'm here for XYZ. This is my preventative check or whatever the visit was for, but I have other concerns I'd like to address too. And this is really important to me before I leave. So I just want to just let you know off the bat what I really will feel comfortable and feel satisfied with if this is answered by the time of our visit. So making that time to show that you're being engaged. That'd be my first tip. Two, the second part I would say is family history. So you would be, I'm sure you're not surprised, because a lot of times health is not a conversation we like to have in our community, but family history is so big. I recently saw a post on social media where people were talking about, when you should get screened for your mammogram, when you should get screened for your pap smear and get tested for cholesterol, all these things. Those are guidelines, right? So when you present to me, one thing that's going to let me know about how I tailor your care to you is to say, okay, but what else is in your family history? Because just knowing the different conditions that exist may tell me, you know what? I want to check on this sooner than later. I want to make sure we have a really comprehensive and complete treatment plan and follow-up and recommendations for you. But when you come in, you're like, I don't know, I heard this person died of X. They just said she died. Like, I think we have to, I'm challenging a lot of young women to go, when you go to those cookouts, when you go to those family dinners and you hear, I'm not sure why they were sick, press a little bit, ask those questions. Well, were they taking medication? Did they end up having surgery? Even when you don't know the medical term, just get a good sense of it. And when you go to your doctor, you can say, I'm not sure, doc, but I heard she had an issue with her thyroid. It got to the point where she required surgery. Just even that context will help the doctor say, oh, okay, it may be XYX, condition. So I don't need you to be, finessing the medical terms because it's like a whole nother language, but at least knowing your family history is really, really, really important. And then my last tip will be partnership, right? So think of this going to your healthcare doctor as having a relationship. So not as much as I say, make time and be engaged. If you don't feel comfortable with that person you're seeing, find another person, because you need to have that trust and that partnership so you can actually share what you're going through and what's on your mind.
Okay, Dr. Sherry. Okay, all of that was great. Let me do my pinpoints, right? So first, about the making the time. Oh my gosh, that is so important. We're so busy, right? We have so much going on, but to your point, we will treat, showing up to the doctors as everything else, like, oh, child, we got a 30-minute meeting, child. Let me just go ahead and get it out the way. But to your point, that shouldn't be that way. Take the time, because it is your health. And that's why we're here, right? For this week, we're talking about making your health a priority. Secondly, family history. Oh my gosh, that is so, so, so important. I didn't realize I had a history of high cholesterol. And then my dad was like, oh yeah, I had a minor heart attack a couple of years ago.
Yes.
What?
Yes.
You know what? That's some of the things that happen, right? And to your point of being around those family gatherings and kind of prying a little bit for that information is important. I think one of the things that we're finding out as an organization, pre-diabetes, right?
Yep.
You may have someone in the family, had a little sugar. That's why we say a little sugar, or type 2 diabetes, but that is something that puts you at risk. And so folks, young people aren't really thinking about, oh, do I have pre-diabetes? Well, if it says pre-diabetes, that means I don't have type 2 diabetes. But no, that is important, because to your point, these are guidelines, but there are other things that you can do to ask and to get screened for conditions that may not come up. So thank you for making all of those points. You can see, like, as you were talking, I was like, yes. Yes. Ask my dad about that. But so my next question to you, Dr. Sherry, is what do you say to young Black women who may be turned off by the healthcare system because of their negative experiences, and then they eventually forego routine care and exams? What do you say to them? What's something encouraging that you can say to them to bring them back into the care system and to make it a priority to them?
Yeah, that's such a great point. I think I have to start with validation. And just speaking candidly and transparently, even as a healthcare provider, a physician in the system, I've faced this microaggressions, discrimination, and racism myself, right? And this is among colleagues, among other people, and I had the credentials, so I can only imagine what patients who, already don't feel like they have the terminology, they may not feel comfortable, are experiencing too. So the first thing I will say is validation. And one thing that I think we need to do better is if you encounter an experience where you feel belittled, you feel demeaned, say something. Because what will often happen is I'll see patients later on and they're like, oh my God, I'm so happy to see you, Dr. Sherry. Let me tell you about my last experience. And I was like, did you report it? Because a lot of times we've almost internalized those experiences and we expect them, and then they continue because there is no sense of accountability because no one's saying anything, right? So the first thing is validation. If you know when you feel like someone's listening to you, you know exactly when you feel like you feel seen. We've seen it. I mean, a perfect example is when you're walking down the street and you see sis with her hair done. You're like, yes, I see you. And you get all, you get excited. You don't even know this person, but you feel so seen when someone's saying skin is glowing, melanin on point, your hair looks good. So we know, we are so good as women about seeing each other. So you know what that feels like. So if you enter a situation in a healthcare environment where you don't feel seen, you don't feel validated, you feel like someone's ignoring your responses, ignoring your concerns, absolutely report them, and you are accurate. But don't let that stop you, because at the end of the day, health is our priority, right? So we should do better about talking to friends and asking, hey, what doctor do you see? Do you have a primary care doctor that you love? Because that's the best recommendation. Is there an OBGYN that you love? Is there a healthcare system or office you go to where you feel very comfortable? Because I'm trying to find a doctor and I don't like my experience. So yes, you're validated in the fact that you may not feel seen. You may have had a bad encounter, but seek out opportunities to find out where those doctors are who will see you, who will hear you, who will actually listen to your concerns and make sure they're addressed. Because the best medicine is prevention. If we wait till you are diagnosed with a medical condition, a lot of times we are too late. And prevention, especially when you're young, keeping that stride of seeing your doctor, staying healthy, being up to date with your screenings pays dividends, because we can't necessarily guarantee you won't have disease, but the more healthy you are prior to disease really helps with your outcomes.
Yes, thank you so much, Dr. Sherry, for that insight. So we will loop you back in for the roundtable discussion towards the end.
Thank you.
So next up, we have Adey.
Hello.
Hi. So Adey, can you tell us about the Black Motherhood Through the Lens documentary and why you felt it was needed?
Thank you for that question. So for me, I started creating Black Motherhood Through the Lens starting from my first year of medical school. At the time, there was a lot of media attention about the Black maternal mortality crisis, which of course hit quite close to home to me as a Black woman myself who hopes to have a child in the future. And so, there was a lot of media attention surrounding that area, but I also felt that there wasn't much media attention being raised to other health disparities impacting Black women in the reproductive healthcare system, especially when it comes to fertility, when it comes to postpartum mood and anxiety disorders. Various statistics show that Black women actually may be 2 times more likely to experience infertility and 2 times more likely to experience postpartum mood and anxiety disorders, such as like postpartum depression. And those are not due to biological differences, but due to things such as medical racism, lack of access to care, et cetera, things that we are all familiar with. And so for me, as a Black woman, as a Black documentary filmmaker, I thought it was really important to capture those stories of Black women's experiences along the continuum of reproductive health care. And then also, I think it's powerful to have this documentary through the lens of a Black woman producer, because you just have that connection with fellow Black women, and it just can create a different feel. And so for me, that was my motivation in creating the documentary, to raise awareness about some of the other disparities Black women face when it comes to reproductive healthcare system. And of course, it just touched the surface. There's a lot more that it didn't even necessarily cover.
Yeah. Yes, thank you so much, Adey. And we can never have too many Black women sharing their stories. So I'm thankful that you were able to capture that amongst those 4 women. So what do you think is needed in addition to making sure Black women's stories are being told?
Great question as well. So of course, with narratives, that can connect people to issues that don't necessarily affect them, because there's something really powerful about seeing a photograph or just watching someone on screen. There's that connection there. But that is not the solution. I think some solutions include accountability. So holding institutions accountable for the harm that's been done to Black people across generations. Of course, there needs to be institutional change. I'll talk about some legislation that's currently possibly, hopefully being passed. So the Omnibus bill, there is legislation in there that will extend postpartum Medicaid coverage to about a year, I believe. And so that's really important because that can help women from various backgrounds access really critical postpartum care. In addition, there's legislation to increase doula coverage, and doula and midwifery has been shown to, help Black women in the reproductive health care system. Because I do believe that midwives and doulas can work alongside doctors and provide really great care. And so those are just some of the ways that I think change can happen. In addition, I think a true commitment to anti-racism is very important, right? Like really naming it and really having a commitment to combat that is extremely important as well.
Yes, thank you, Adey. That's so important, accountability and being able to call those things out. Doulas and midwives are so important. Here at the Black Women's Health Imperative, we have our doula program because we see that it can make a difference in the lives of families, especially Black families, as we think about postpartum depression and some of those things that Black women experience as they navigate through their birthing experiences. So thank you for that. So, what were some pearls of wisdom shared by these women that need to be uplifted in our conversation today?
Wow, there's so many pearls because, again, strong kudos to the 4 Black women in the documentary: Ijoma, Shannon, Shailene, and Jamie. Without them, Black Motherhood Lead Ones would not have existed. And so I'm super grateful for their vulnerability and bravery to share their stories with the world. So a big theme that came up was, which we kind of discussed here already, is the importance of self-advocacy. Jamie talks a lot about that in her experience with postpartum depression and how she experienced that in her first birth. And so for her second birth, she did a lot of research in figuring out ways to prevent it from happening again. And so it's really unfortunate that Black women particularly need to do all of that pre-work to, get maybe half the treatment that other people exist. But I think that was a very major theme. And then another thing is pushing against stigma and stereotypes. So Ijoma experienced infertility for about a year and discusses how social media perceptions of Black women are often, painting Black women as being hypersexual, hyperfertile, and that can be really challenging to go through. Well, first of all, it's very problematic, but then also if someone is having issues conceiving, it just makes that all the more challenging. So I think themes of like social stigma and just like reimagining these societal norms that are placed on Black women is another theme as well. And then lastly, I think empathy really came up because there was a lot of unfortunate moments that happened to the women on account of healthcare providers, imposing those societal norms and then also not being empathetic or sensitive in the way they handled their experiences navigating the reproductive healthcare system.
Yes, thank you for that. And those were great pearls of wisdom because there are so many points, such as self-advocacy, that's so important. And I often wonder about folks and experiences and how other systems come into play that deters folks from wanting to share their stories, right? So as we think about Black moms in particular, who may experience postpartum depression but may not want to say anything for fear of other systems and impeding on their lives and things like that. So did any of that come up in creating the documentary or in sourcing who you wanted to include, any fear around sharing their stories for, further perpetuating any stigma that was associated with their experiences?
I would say that the women were very open to speaking with me and sharing their stories because they felt that it was really important to get the word out there. In terms of kind of pushback or feeling maybe a little bit more, I don't know, not necessarily wanting to share, I would say that so the university that I'm a part of has an interesting relationship with the community that it's in. And so that was a dynamic that I had to navigate, still being a student, still being part of the ivory tower, of being a Black woman. So having to navigate that was important and interesting to deal with. But I think overall, they were all for being like, this is challenging. It's, triggering to have to relive these really difficult moments. But, they felt that it was for the greater good. And so, again, I'm very, very grateful for all four of them.
Yes, we are too, right? Because that's 4 more women whose story is out there and can help someone else. So thank you for that. So Adey, my last question to you is, as a medical student, how do you grapple with what is being taught through curricula and what you're witnessing and also documenting?
That's an interesting question because, over my past 4 years in medical school, there's been an increased push for changes in the curricula surrounding diversity, equity, and inclusion. When I started off, there was, a small part in one of our courses, and over time, a lot of students have advocated for it to be done in a different way. I would say I have the privilege of attending a university that's fairly liberal, fairly socially conscious, and really supports the work that I do. And I know that's not the case for a lot of medical students. I would say for me, I still have had to navigate, how do I be an advocate? How do I speak out about issues impacting people that look like me, but also maintaining my status as a medical student, right? The medical system is still pretty conservative and people can run into issues when it comes to advocacy. And so kind of figuring out a way to do both has been a challenge. And it's just something that one has to continue to do. So I would say that, I guess, is the only thing that has been a challenge in regards to like curriculum. It hasn't really been like, okay, like what we're learning doesn't align with like my beliefs, but it's more so how do I do the work that I'm passionate about, but still, securing that MD because we need more doctors that look like us.
Yes, that is so important. And so I see that you are combining the two and making the change, even though it is challenging. So thank you, Adey, for your insights as well. So I'd like to bring back Lauren and Dr. Sherry for our roundtable discussion. So we have some questions in the chat as well as some questions that I have for you. And so one question came in and it says, why are doulas not more mainstream? Well, we know why. Well, we know why, because that is something that is one of those areas where it's been happening, right? So anyone can be a doula, which I'm learning, and we all kind of fulfill this role, but having it more in a certified role is something that folks don't want to pay for in terms of reimbursement and making sure that it's embedded into the medical field, although it is a non-medical role. But anyone else want to chime in?
Yeah, I wanted to chime in to provide some historical context that I actually learned about recently. So there's this great documentary out there called Aftershock that actually won at Sundance, and it's about Black maternal mortality. And in that documentary, they actually talk about Black midwives specifically and how actually white public health nurses and white OBGYNs specifically had campaigns to diminish the social standing of Black midwives years ago. And so that also contributes to maybe why midwives or doulas maybe aren't as mainstream as they could be. So I thought that was interesting, unfortunate, and something I learned about recently.
Yeah.
I think to add to that, Adey, I love that historical context is also, we don't do a very good job in the medical world of thinking about communities and their cultural norms and what's important. And oftentimes people have focused on, well, what does the evidence-based guideline show? And we're so almost feeling overly regimented. And why is this important? Let's be honest. A lot of our evidence-based guidelines, that very evidence, the study, didn't even have us in it, right? So, and I think in light of the pandemic and everything happening, that is being shown on social media a lot and been part of the conversation where the things we call evidence-based aren't in fact actually tailored to our community. So I think we are at this really great point in healthcare, where we're not just saying, you know, how are we having diversity in clinical trials, but we're also saying, what are the other healing effects of care that we don't actually place enough value on, like community care, like having doula support, right? That we exist in community in our Black culture, right? And that is healing, actually, right? That plays a part. But a lot of time there's such an emphasis on Western therapies that we have to do better of actually looking at populations, not just in terms of disparity, but also looking at the positives. What are the things we're not considering that plays a part in their actual healing and prevention and supporting of this population or this group? And in this case, when we're talking about Black women.
Yes. Thank you, Dr. Sherry. You brought up one of the things that I wanted to talk a little bit more about, which was community care, right? So community care, for those in the audience, is using your power, your privilege, and your resources to better the people who are both in and out of our scope of reach. So to each of you, Adey, Lauren, Dr. Sherry, can you all talk about why you think community care is important in addition to self-care, right? Because we talk about self-care, doing, you know, this individualism about taking care of ourselves, but there's a community care aspect of it. And then also just two-pronged question, right? And then talk about how we can cultivate this, especially as folks are navigating in and out of systems.
I can start. So I guess I'll chime in also too from the organization that I also represent, Health in Our Hue, because we've looked very much into this community aspect as well too, right? So I think it's the best setting I can use is almost like church or the beauty salon, where people come together, they share certain things. They're like, oh yeah, that happened to me too. And you leave there, and although you came for like a hairstyle, you feel empowered, right? Like you feel like someone saw you and you got other bits of information, whether it's like knowing what's going on in the neighborhood, but also key things about health. So in with Health in Our Hue, we've been thinking about this, like how can community care play a part? And one way, one of their services we've provided is called virtual care squads. So what we thought of is that very setting that you often see in the community, like at the beauty salon, the church, or the sorority. How can we actually use that for health? So we curate these groups of people who come together around a medical topic. And we have a curriculum that has been designated by a clinician. It's tailored to the audience, which is Black women. And women come together not only to engage with the curriculum on an individual independent basis, but together in a group with a facilitator. And as a person who's actually facilitated that group, I can tell you it's been impactful. Like we are now in our second cohort, and women have talked about how it changed their lives. And we are currently doing one on mental health. And the biggest thing I saw was women saying, oh my God, I was going through that too, but I thought I was the only one. So almost even a sense of validation. And this is coming from women who are in different areas in the country, right? Because a lot of times we think the Black women's experience is the same. It changes depending on age, demographics, where you live, what you've experienced, what your cultural background is. So to have women who even vary in location, who vary in age groups say, wow, I thought I was the only one. And because I thought I was the only one, I wasn't actually sharing. So even a sense of validation, which can be therapeutic, because now you're almost now feeling more comfortable saying, okay, well, let me talk more about this because I don't feel so scared to actually share what I'm going through. One. And two, you have other women saying, well, I tried this, or, you know, in our case, when we talk about mental health, I actually went to a therapist. It was really helpful for me. So a lot of the taboos that people haven't even wanted to entertain, now they feel more comfortable actually approaching that topic, such as going to therapy, such as considering medications. So that community care allows you to, one, feel seen, feel validated, and then ask more questions to someone who looks like you, where that dynamic of feeling like, oh my God, I'm kind of nervous to talk to the doctor about that, or the nurse practitioner, because I don't want them to feel like I'm stupid or I don't know something. You can now ask your peer and feel seen in having that conversation.
Yeah. I really like what Dr. Sherry had to say about like validating experiences. I can speak to a particular narrative in the documentary. Shailene talks about her experience breastfeeding as a Black woman, and she was actually told that her breasts were too big for her baby's small jaw, verbatim. And actually, she luckily found a breastfeeding support group called Chocolate Milk Cafe. Some of you might already be familiar with it. But she actually says being there really validated her experience breastfeeding. And, she said other women's breasts looked like hers and she didn't feel alienated and people weren't making comments like that, and for her second child, she was actually able to breastfeed for 4 years, going through Chocolate Milk Cafe. So that's just one also specific example of how community and how support groups can validate people's experiences, be like, okay, this is someone who looks like me, and can have a really positive impact. So wanted to share that narrative.
Yes, thank you.
For me, of course, I just have to agree with them on so many different levels. It's community care is your safe haven. It's your safety net. It's where you go to feel comfortable, where you don't have to worry about being vulnerable at. And of course, just like you said, the hair salon, being around your sister circle, a sorority, things of that nature, where you can just honestly let your hair down and share your story, and not feel worried about being judged. And a lot of times we don't recognize, like you said, Dr. Cherry, you just talked about how we didn't realize we were connected on so many different levels because we're Black women, but we're so different, but we're similar. And it's really a great feeling to have. So community care is amazing. And I'm glad that the thing we're starting to shift. We're starting to get a little bit more open to different ideas, different things we could be doing in the community, because honestly, that's how a lot of people are getting diagnosed, is having these conversations about your your periods, about how you feel after pregnancy, before pregnancy. I think I've learned a couple of things from sitting next to some of my sisters, literally talking about just how they were after they had birth, or how they feel during pregnancy, or how they're feeling prior to. And it's like, oh, I didn't know. Oh, I didn't know that was a thing. So now, when I'm going through my process, I'm going to be thinking about these things because now there's some awareness piece around it. So, community care is definitely something that is beneficial. Like I said, I'm glad to see it grow. I do see that we still have a lot of work to do in the community, and making sure that a lot more people feel comfortable, but I love it.
Yes. Thank all of you for your responses to that, because community care is so important and we have to embed it, right? Even when we think about lifestyle changes for Black women, you can't say, oh, to prevent type 2 diabetes, you got to go in alone. You need that community, right? And so, what we've done with the My Sisters Keep Our High Health program is add that supplemental support, the peer support groups, right? So that way you can have the conversations as you are navigating a curriculum that teaches you how to change your lifestyle, but then also engage in conversations about protecting your heart, right? Both physically and emotionally, and including that emotional wellness piece, because the conversations are what heals us. I believe that. And so embedding the conversations into everything that we do is our superpower. And I just love that from all of our experiences that is included. So there is a question from the audience for you, Lauren, specifically about CBD and what you would recommend for folks with endometriosis.
Specifically for me, and I always say that because I think that what I may do or what I may use for me may not always help you. Specifically for me, I am really big on using Juno World, which is a CBD product. It is a topical. It does relieve pain. It does relieve stress. I also use the drops, which also eases, like if you're having nausea, which I do have often, or anxiety, that helps me a lot. Like I said, I think it's important for you to understand CBD a little bit more, for you to do your research on certain products from certain companies. I'm not talking about the CBD that's in the gas station because that's not real. Don't use that. Um, but I also think it's important to really just see what works best for you. And I do have, like I said, Juna, but there's also Kush Queen, the Nor Leaf. There's a lot of companies out here that actually have a lot of products that may be beneficial. And sometimes I swap, so I may use Kush Queen and Juna. There may be like a roll on. They may help my knee, but I may use the topical and rub that on my hands, or I may use the drops when I'm feeling nauseous. So, I also use gummies sometimes if I'm having trouble sleeping and things of that nature. So, just be mindful. Again, do your research. I think that's the most important thing I can say about that. And just make sure you're uh, trying different things. It's not going to be a one size fit all. You may have to use a different product from me because your pain may be on a different level.
Yes, thank you, Lauren, for sharing that. And so, just one final question for each of you. There are young Black women out there who are seeing you right now and want to take similar paths as yours. Can each of you share what has helped you get to where you are today and any advice you have for them?
I'll go. My first thing is just be true to yourself. Be true to yourself. I think a lot of times we get into roles or we begin a journey and we think we have to adjust. You do have to adjust, but you don't have to change who you are in the core. And I think it's important to hold on who you genuinely are. I think it's also important to take your time. Uh, and understand that there's no rule book to this. There may be other people in different positions that you're trying to emulate, but for you specifically, you've never done this before. So take your time at it. Be kind to yourself. Don't rush the process. Everything is gradually going to take its course. I remember planning my first conference and being stressed out with virtual, and then getting to the conference in person and being stressed out with that. So, thinking and understanding like, wow, like I did this, but I put it together. But at the same time, it took a process. It took time. You can't rush it. Things just don't pop up overnight. So just give yourself some grace and understand that everything is of the essence. Take your time with it, enjoy yourself, and don't hold up.
Thank you.
I can go next. I think to summarize, love everything Lauren said too. So some of this might also sound like what she's saying as well. But I think if I can talk about my experience, having a circle of friends, both men and women, specifically Black women, Black men in my life who are on their journeys as well has been key. But there's just something about Black women supporting other Black women that just does something for you. So if you can find your circle early on, understand that it may change, you may grow, you guys may evolve, but just be there for each other is big. I love the piece about authenticity. Think about what impact you want to have. And that I think was key from a mentor that I heard very early on. You can think about the titles and the degrees, but what's your impact? Like, what do you want people to remember you for? And how can you do that authentically being yourself? We are at a time, as we're thinking about how we help our community, how we help other Black women, they need to see you. They don't need to see you, assimilating and acting like something you're not. Be authentic. And most recently, a quote I heard from someone that was really impactful was, in a lifetime, you can live many lives. So as you think about your goals and where you want to go, it's okay as you shift. So in this lifetime, you have one life to live, but you can live many lives. You can do one thing first and then you shift, and it's okay. It doesn't mean that you're being someone else. It just means that you're committed to growth and evolving.
Amazing pearls. So for me, I would say one of the main things that's helped me get to this point has been my faith in God. I know not everyone is a believer, but for me, that was really integral, helping me on the day to day. I would say that some advice I have for other Black women, I think there's something really powerful about writing down your vision and goals. That's something I started doing over the past couple of years. People talk about the vision board, et cetera, but it's really nice to have something to go back and like meditate on. When I went home in December, I saw a scrapbook I made back when I was like 9. I had a picture of me in a white coat that my parents gave me for my birthday and a stethoscope that they gave me. And now I'm like 18 days away from graduating with my MD. It surely was not an easy road, but kind of having that like in the back of my head and having my parents like affirm that vision and always telling me that it was possible is a privilege, and it was really helpful in the journey. And then lastly, to echo what Lauren talked about, I think grace is really important. I think the society we live in is really hard on Black women. You know, we have to be perfect. We have to have it 100% together. We have to continuously produce, and that can be really challenging to deal with. And so I think it's really important that we prioritize our mental health, because without our mental health, we don't have anything at all. And so I think it's really important to, you know, sometimes you want to be your own boss, that's fine. But sometimes success can look like what my mentor told me the other day, literally getting up and like getting ready for the day, depending on what your circumstances are. So that would be my pearl for other Black women.
Well, thank you all. I am so inspired by you in this amazing panel and all the work that each of you are doing for Black women. And I'm just so grateful to have shared the stage, this virtual stage, with each and every one of you. So thank you. I also thank you to our audience for tuning in, and for the folks that were asking questions. Thank you so much. Join us tomorrow at 12 p.m. Eastern for the Well Conversation about mental health and wellness with therapist and blogger Key Rose, followed by our rescheduled yoga demonstration at 1 p.m. Eastern. Don't forget to RSVP at the link below to receive your MSK self-care box. Thank you and take care.